Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant non-stop show 1018th episode. Let's have the headlines of the day. Among the 1.9 billion women of reproductive age group, that is between 15 to 49 years, worldwide 1.1 billion have a need for family planning. Expressed deliberates on the rising demand for social egg freezing in India. 40% of women aged between 25 to 32 pursuing egg freezing, EPAI insights. 35% of women from IT sector are opting for egg freezing claims report. Program allows women to donate half their eggs, freeze the rest for the free amid rising costs. So now let's go to the topic of the day. We will be talking about social freezing of eggs. एक तो होती है जहाँ जरूरत होती है, किसी वजह से उसको कोई प्रॉब्लम हो जाती है, लाइक कैंसर या कैंसर ट्रीटमेंट या व्हाटएवर, तो एक लेडी को अपनी प्रेगनेंसी पोस्टपोन करनी पड़ती है। और एक होती है जो सोशल कारणों से उसे अपनी प्रेगनेंसी करनी है पर थोड़ी लेट करनी है, तो वो सोशल फ्रीजिंग करती हैं। ये सब क्या है, कैसे किया जाता है, आज ये सब बताने के लिए हमारे बीच आए हैं डॉक्टर PM गोपीनाथ। Dr. PM Gopinath is a distinguished medical professional and the director of Department of Reproductive Medicine at Kaveri Hospital in Tamil Nadu. With an impressive academic background holding an MBBS, DGO and MD, Dr. Gopinath has dedicated his career to advancing the field of reproductive medicine. His extensive expertise and compassionate approach have earned him recognition as a leading specialist in fertility treatments and reproductive health. At Kaveri Hospital, Dr. Gopinath leads a team of experts committed to providing innovative solutions and personalized care to individuals and couples facing reproductive challenges, helping them realize their dreams of parenthood. So, he will be with us today. Welcome, Dr. Gopinath. Shall we start our session?
Thank you, Dr. Anita, for that nice introduction. If you are thinking about social freezing of the eggs, we all thought that it is only an experiment. So in 2012, ASRM has just declared it is no more experimental. It can be offered on clinical care. However, they added a caution saying that it should not be done for social reasons. There again, on 2013, they announced that new guidelines saying that it can be used for the social freezing. From 2014, Canadian society has come forward with the guidelines about social freezing. From then on, there's a lot of awareness has been given for social freezing of the eggs. Besides the fertility preservation, social freezing as such has just come in a long way now. So if we try to understand the basics between the male and female, male, every 72 days new sperm is being produced. So thereby it is only 72 days old. And then even at the age of 50 or 55, they can reproduce and have a normal haploid child. Whereas in female, all the eggs are arrested at the second meiotic division at the diplotin stage right from birth. So gradually, some of them are getting released for every cycle, say around 30 or 40 eggs. So if you take a woman at the age of 40, her egg is arrested at the cleavage stage for about 40 years. That is how there is an increase in miscarriages, difficulty in conception, all this takes place. So with all this mind, when people have been working all over the world, they have come to know menopause is not the end of the reproductive career. It is much more earlier than that. So there is a decline in your fertility potential much earlier than menopause. If you take Asian women, they obtain a little earlier when compared to the Western women. So, with all this in mind, the woman thinks probably she can go in for oocyte cryopreservation to preserve her eggs. How does she takes a position? When she is around 28 to 30, when she has decided not to get married and opt for her career and then higher positioning and the company commitments, based on that she wants to postpone her child, then she comes with that issue saying that we will have a social freezing. So when she comes with that, what is the benefit she gets out of the social freezing? Number one, she gets a genetically her own baby. Number two, there is no abnormalities related to the age-related problems because this eggs are taken much earlier than that. Now, again, this is a double-edged weapon. What are the disadvantages of this, or rather side effects of it? It is mainly about the ovarian stimulation. When you stimulate the ovary, it normally there is 1 to 2% chances of ovarian hyperstimulation syndrome. But those days, about 2 to 3 decades ago, it was a dreaded complication. But today, with our understanding about the OHS problem, we do come across very, very negligible cases of ovarian hyperstimulation. That also, we have an excellent drug antag with us to overcome the problems there. So the problem, the complication of ovarian hyperstimulation is ruled out. So the next thing what you can think of is about the drugs. She will be requiring multiple stimulations. Normally, you get only about one oocyte, one ovum per cycle. If you are going to do a preservation, you might be needing about 15 oocytes. So we will be taking a lot of gonadotrophins to stimulate her, give her anesthesia, do a transvaginal scan, take out the oocytes. All this has to be taken into the consideration. Another important event is if she is going to go in for a social freezing, she has to come back, thaw the oocytes, and then she has to undergo only an IVF. She cannot conceive naturally. That point we have to update to them. So it is up to the family physician, general gynecologist, and all the people to create an awareness about social freezing, and then they have to put it forward to them, and then they have to choose whether they can afford, whether they can just undergo that. If you take multinationals like Tata and various big companies, they have come forward to support social egg freezing, and they pay the money for social egg freezing for the simple factor the continuity in the carrier is taken into consideration for their higher position. So they don't want a discontinuity at the optimal level, so they are just paying. So more or less almost all the companies has to come up, and insurance has to be enhanced. Today there is no insurance for a oocyte freezing. We have to enhance that. We have to empanel it and make sure that everybody takes a good share in giving this CSR activity, what we call it as a social egg freezing.
So the next question is, at what age is it best to freeze the eggs? If you
Yes,
want to
it's a
advise a
very,
woman.
very wonderful point. You cannot come at 40 and then do egg freezing because you are not avoiding the age related complication. Ideal age is around 30s. That is the time you will have a good ovarian reserve. You will be able to, you won't have any complications. You will be very easily able to take it out. Even if you plan for a pregnancy at 34 or 35, you will not have age related complications when you get pregnant with that ovum.
That's very nice. And so, like you told us what exactly she has to take so that an egg can be formed. But what is the process which is involved in steps involved in retrieval of the egg? How do we take it out from a woman's body?
Um, Actually, the moment you just do a controlled ovarian hyperstimulation, when you get a good follicles, we just give them a final maturation, what we call as the trigger. After 36 hours after the trigger, we take them to that IVF theater, give them general anesthesia, and then do a transvaginal ultrasound. Under the ultrasound guidance, each and every follicle will be aspirated and the oocytes will be trapped. If they will be identified, then they will be taken up. Again, those days we used to have a slow freezing where it used to take hours together to go through a slow freezing, and a planner is the equipment what it is too expensive, and then it will take long time. Today the lot of revolution has taken place in the freezing by way of vitrification. Vitrification is a process where it just gets a dip by adding a small medium, vitrification medium, that this process of the freezing the egg takes place in no time, and then they are able to withstand the temperature. They are able to have a better survival when we thaw them.
And how long can frozen eggs be stored?
By ART law, they say that you can preserve the gametes only for 5 years. So as of now, it is only for 5 years by law. But in case if there happens to be something like, if, for example, the patient gets her oocyte harvested at the age of 30, and she gets a breast cancer at 32, and then it becomes not a social freezing, it becomes a fertility preservation. In that particular scenario, you will be able to take it up to 10 years for the complete treatment of the cancer. So if for social freezing it is only 5 years, for fertility preservation up to 10 years.
Okay. And are there any risk associated with egg freezing?
um, the risk associated with the stimulation, and associated with the trigger, risk associated with the procedure. Stimulation today has been standardized. We have a very good protocols, we have very good monitoring system, and we do aim exactly what we want. Trigger is, there is ideal triggers are available. In case if there is excess of more than 15 oocytes are developing, we give a GnRH trigger. Sometimes we use a dual trigger. With that, we prevent ovarian hyperstimulation. So that in that scenario, when we take out these eggs under anesthesia, there is absolutely no risk of the thing. Patient can go home within about 2 to 3 hours after the procedure.
So, and what is the success rate of pregnancy once these eggs are used to cause pregnancy in that lady?
Yeah. So previously, in a small study where then they used a slow freezing techniques, there was a hardening of the zona. There was a difficulty in doing an ICSI. There was a difficulty in achieving a pregnancy. Whereas today, with the vitrification, our normal fertilization rate of around 40 to 45% can be offered very easily to these cases of social egg freezing cases.
Another question I'd like to ask, is it better to freeze the eggs or to, if a lady has a partner or a husband and for some reason they don't want to have a pregnancy now, so they make a zygote and then freeze that? What is better?
Madam, it's a very tricky question. Usually, this scenario is happening in the West. What actually they do, if they have a partner, they harvest the eggs. Half of them, they create embryos, and the other half, they create as a oocyte. For the simple reason, there may be a change in partnership. However,
Yes.
that scenario is yet to reach our part. So generally, if the partner is available, it is best is to get the embryos created and then preserved. If the partner is not available, then it is better to take the oocyte.
So I wanted to know this technical difference. Of course, partners may change. Even after marriage, they may change. So that is very legally a very difficult situation. So how much does this egg freezing typically cost a patient?
See, probably about 60% of the IVF cost in any given center should be the cost for IVF freezing. The freezing charges for about some average 10 eggs should be around 5 to 6,000 rupees for every 6 months. They have to keep paying and renewing.
Okay. So, and as far as insurance is concerned, they don't pay for infertility and they don't pay for egg freezing also, even if it is for medical reasons.
Now, if it is a medical reason, for example, in my institution, they give 50% discount. That is, if you pay for 6 months, you can store them for 1 year if it is for a fertility preservation. If it is for the social, you have to just keep renewing it every 6 months.
Yes. And how does one choose a clinic where to go for egg retrieval and freezing?
This is again a very important point. IVF centers are mushrooming everywhere.
Yes.
So you have to see, you should have a long standing center. See, for example, you freeze the eggs and then the center closes by about the next
Yes.
year. It's not going to be your problem solving. So you should see a long standing IVF centers who have got a standard results. The results should not be like a roller coaster where one time you give about 30%, second time it is 15%. You should have a uniform standard. So look into the centers, look into the infrastructure, look into the age and then stability of the patient, the center. Look at the results of that center. Then you should choose the center for oocyte freezing.
Another question that I'd like to ask is, like you said, center may be closing down. Before closing down, legally, do they have to inform all those people who've frozen their eggs or zygotes that we are closing down and you may move them?
Usually, they don't. The law does not permit them to just close down. So when you
Mhm.
close down, there is a legal system of changing from gamete from one center to other center. We have to write to them, and then we have to get a central registry's permission, and then shift it to another center. It is possible to shift gametes from one center to other center, but it is slightly difficult. So it has got its own process. So that is why you should choose a long standing center with the standard results when you are planning for oocyte freezing.
There's a patient online who sent a message that I have some zygotes frozen in a foreign country, and now I wish to come to India and have the IVF done. Is it possible? She's an
Yeah,
Indian
it
by
is
birth.
possible. It is
Hmm.
possible. We can shift the oocytes from center to center. The first is the patient has to write a letter, and then there is an affidavit. There is a form available in the ART law. Then the center which is giving should say that they are giving. The center who should receiving it should give a permission saying that they are willing to receive it. Then you submit all the patient all these documents online to the central registry, and then you will get a reply. Based on the reply, you can shift them.
Okay. And
Shipping
what are
is
this?
possible.
Mm-hmm.
Shipping
Or
is
you can.
possible. Even dry
Mhm.
shipping is possible.
Okay, that's
There
very
are
nice.
agencies who will be
Hmm.
able to do it.
Very great. That's really great information. So, what are the side effects of the medications used for egg freezing? Starting from what we give to the
Usually,
patient?
no. When we give this medications, usually all of them last only for that particular menstrual cycle. Say once when they get their cycles back, everything is washed off. They will be able to get back to the normalcy. The next cycle is going to be normal, or it may be slightly earlier than they expected. Otherwise, there is no side effects for this particular stimulation protocol, what you are using it.
There's a lady,
But
she says, yes, yes,
another
yes,
important event, do not go by the age, because the patient might come to you at the age of 32 and say that she wants to preserve. Please have a good evaluation, do an anti-Mullerian hormone, do an antral follicular count, and then consider what is her basal reserve. Otherwise, you will end up miserably after stimulation, getting only about a couple of eggs. So we have to completely evaluate that patient and then take them for social egg freezing.
There's another patient who's asking, like, besides cancer, if I have any other medical condition, uh, can you enumerate what medical condition would want her to have her eggs frozen?
Usually, any patient who has got a, for example, a Turner, Mosaic, those people, they will go in for a premature menopause.
Yes,
So,
yes.
at the earliest, they have to just preserve. Any rheumatoid patients, they whenever when there is an issue and then probably immunologically stated, it is better to take it a little earlier. And if they have endometriosis at a very young age, then those are the people who should go for oocyte freezing.
Very well said. So, this lady, another one, is asking online, how many eggs minimum should I freeze in maybe 1 or 2 cycles if required to have maximize the chance of getting pregnant in future?
There is a famous work by one of our Indian who is settled in UK called Sesh Kamal Chumkara. She has come out the best number of eggs to achieve the maximum pregnancy is 15 and 16 as per the meta-analysis. So ideally you
Okay.
will have around 15 to 16 eggs is optimal. So if you are not able to get it in one cycle, probably you can even rest a cycle and then again do on the second alternate month and just try to get about 15 or 16 oocytes.
Very nice. And what happens after my eggs are retrieved and frozen? Uh, she comes back at a later date. Whatever she uses, she gets a baby. What happens to the others?
The other eggs, she has an option, one to discard or to give it for research. She cannot donate the eggs to anybody. The law does not permit them to donate the eggs. They can only use it for research, or they have to discard. Most probably, if you have got a baby, it is always worthwhile waiting for the second one to give it a small
Back after
try.
5 or 6.
So until the baby is grown up, well, devoid of all the diseases, you take the decision, then give a discard.
So another question is that how will I know whether these frozen eggs are still viable and usable?
Yeah, it is a logical question, but there is no way of knowing. The process of vitrification, only when you take it out and thaw, you will know. The in normal process of vitrification and thawing, the survival rate is more than 95%. So you expect about more than 95% chances of your eggs surviving back to normal when you want to use it.
Another question is, are there any ethical problems with doing all of this?
um, there has to be an informed consent, and then all the knowledge should be shared, and then there is a consent should be signed by the patient, and then you can go about. there is no ethical issues with this. So usually it is illegal. It's a legal problem. There is no legal issues attached to it. So there is ethics permits us to do a social egg freezing.
And can men also freeze their sperms for a long time?
Yes, it is very easy. As I've said, the egg is being stored for a longer time, whereas the sperms are being prepared almost every 72 days. So the aging does not affect. But however, if they are going in for any gonadotoxic therapies, then they can freeze their sperms.
Before they undertake any treatment for maybe a cancer or anything like that.
Cancer or methotrexate for any arthritis. So somewhere
Yes,
when
yes.
they take a drug which will affect their fertility, then it is better to freeze their sperms and then take it.
Okay, fine. So that has been a nice explanation. Many of our
Thank you.
listeners have put up messages that can we be told all of this in Hindi? But anyways, there's a lady who's saying, please tell me again, what is the cost of egg freezing? So that I think we can repeat.
It'll any center when you say 60% of the cost of an IVF. For example, in my center, if the cost of an IVF is 2 lakhs, it is going to be 1.2 lakhs for oocyte freezing.
Right. That's very amazing. And you have given us really such good inputs. Now the questions have started coming that besides preserving the eggs, how can one remain young? That is out of our purview of talk today. So I think we will finish it here. Thank you so much, Dr. PM Gopinath, for joining us today. Could you show us the certificate, please? Can I have the certificate, please, Batul?
Thank you very much, madam. Thank
No,
you.
not at all. This is a
I've been a
small
great
token.
fan of Dr. K.K. Agarwal.
He was my classmate and my best friend in college, medical college. We studied together MBBS and MD both. So this is
A
just a way of
great man.
remembering him. Yes, a great man. Yes. So thank you so much. That certificate is
Thank
just
you.
a token of our
Thank you, madam.
thanks to you for sparing your time. That will be all for today. Dr. KK Med Talks will be back next Friday with another show of Dr. Kant at KK Med Talks, and tomorrow at 7 p.m. with another show of KK Med Talks. Thank you very much. Namaskar and good night.
Thank you. Thank you.
Thank you, Doctor. It was a pleasure.